Good morning, everyone. Hello, my name is Lori Bradner. I'm with the Florida Aviation Network, and we are broadcasting live and in the clear from Sun and Fun 51, where we have our studios set up at the Central Florida Aerospace Academy. Of course, I've got the best job in the world, and I'm absolutely turning up the fun with my next guest. Dr. Busch, thank you. I'd like to welcome you, and thank you for being here. It's always a pleasure to have you here.
Glad to be here.
No, that's awesome. Well, Dr. Busch, you are an aviation doctor, AVDoc for Stallion 51. I know that you are one of our, you're sort of our keystone, cornerstone guests. We ask you back, number one, because you're fun, you're great to talk to, and of course, 51, we're turning up the fun. So tell us a little bit, anything new? What have you been up to? What are you doing? Have you been out on the grounds to see Sun and Fun? How long have you been here?
That was more than one question.
It was like 7 rolled into one.
What have I been doing?
Yes.
Professionally doing the same thing.
Okay.
Seeing a lot of patients.
Yep.
We're very busy, a lot of complicated cases.
Okay.
And it's been fun doing that. I've been to the air show here my second day, and I get around. I try to visit all the attractions and the various aircraft and the pavilions.
What are you thinking so far?
I think this is one of the best I've seen in recent years for aircraft.
Really? May I ask why? Okay.
The variety of aircraft, especially in the antique and warbird categories, is outstanding this year.
Okay.
I've seen aircraft this year in the antique and warbird categories that I've not seen for 10, 15 years here.
Awesome. So Sun and Fun did turn up the fun.
It turned out some good stuff.
That is awesome. Well, talk to us a little bit. You piqued my interest. Obviously, you said you've been very busy. Tell us a little bit about the FAA medical, because I know you're focused on that. But I'm also interested, you said you've seen complicated cases. So what are some of the challenges? Once again, like 7 questions rolled into one, but I know you
first of all, the complicated equations happen because the clinic that we have there at Stallion 51,
right,
we sort of focus and specialize on difficult cases.
Okay.
In other words, we don't do the aviation medicine as an adjunct to our family practice, internal medicine, or whatever practice.
Okay.
It's primarily aviation medicine.
Gotcha.
I'm boarded in ophthalmology. I do ophthalmology, no surgical anymore. I do consults, but the primary focus of our clinic is aviation medicine.
Okay.
So when the other AMEs out there have difficult cases, they send them to us.
Gotcha.
Because let's face it, the kids you have here in your aviation school, they're all pretty easy.
Right.
But you know, when you get older, you get things going on. So those are the ones that come to us. And when I say busy, we're not busy with the healthy people. We're busy with the people that have problems.
And trying to get them cleared so that they can actually either get back in the air or fly.
Labor intensive, time intensive, dealing with the FAA, federal agency, all the above.
Okay. Tell us a little bit. I know I'm backing up a little bit. I know some of our guests, you've been a cornerstone for us, especially during Sun and Fun. And I know we were talking before that you've been coming to Sun and Fun on and off at least for 40 years, since the 1980s. But for viewers that might be looking that they're new, or maybe they're just tuning in now to the Florida Aviation Network, you've got one of the coolest backgrounds ever. Tell us a little bit about how you got into aviation and how you got into what you're doing now. What was the path? What was your path?
How I got into aviation is kind of interesting to me.
Okay.
I was getting ready to graduate from college with a simple major, and I just wanted something to do, and I wanted to get out of town, so I couldn't think of anything, so I started going to the military recruiters, and the Navy recruiter gave me an aptitude test. It says, well, you qualify for aviation. Would you like to apply to be a pilot?
Okay.
And I said, I'd never been in an airplane. I'm not sure I'd like it. Now remember, people are in airplanes now all the time, but this goes back to the early 70s. Okay?
Right.
He says, trust me, you'll like it. So I said, okay, so I applied, and they accepted me. And then
You still hadn't flown?
No. And then I went to the Navy Officer Candidate School, and then I finished that, then I went to flight school. So my first flight in the airplane was in a T-28, and I was a flight student in the Navy.
Okay.
And at the time, I thought, well, that's pretty cool. I'll learn how to fly airplanes, and then I'll go back to the Midwest to be a crop duster.
Right.
So those 3 years that I thought I was going to spend in the Navy turned into almost 30, because I couldn't get out because it was just too much fun.
I bet. That's awesome. So you were flying, but wait a minute. Now you're a doctor, so where was the transition? What did you do? How did you go to medical school?
Well,
was that through the Navy?
Oh, yeah.
Okay.
Well, I got my wings, went to jets, flew the Viking, went to aircraft carriers, did all that for about 7 years. And I did pretty good. I did good, and the Navy was friendly to people that do good, and they sort of asked me what I wanted to do next, and I'd met some guys that were doctor pilots.
Okay.
So I thought that was a very cool thing to do. So I said, I want to go to medical school and be a doctor pilot.
Okay.
Now, this evolution takes months.
Right.
But the big picture is the big Navy said yes, so they sent me to medical school.
Phenomenal.
And that was a little bit longer than I thought. It was about 5 years, and pretty a lot of work. But then I came back and I became a doctor pilot. So I'm flying as a naval aviator and a flight surgeon, a doctor.
Okay. Okay.
And that was a very unique program because I was allowed to get flight time in a wide variety of aircraft. I mean, I flew the B-52 with the Air Force.
Really?
That was a cool thing.
Yeah.
And I was in the Navy. I flew the Harrier with the Marines. And I was in the Navy. So that was the dual designator program.
That's
and
awesome.
many other experiences. And then I didn't get bored really with that lifestyle, but I decided I needed to focus on medicine a little more. So then I applied and was accepted to a program in ophthalmology, which is eye surgery at the National Naval Medical Center in Bethesda.
How did you come to that choice? Why ophthalmology? There's such a wide range.
Should I tell you really? I didn't know how to spell it, so I figured I'd learn how to spell ophthalmology while I did the 3 years of, No, the real reason also is because ophthalmology has a great application to aviation.
Right.
Your vision is your main sense for flying. It's where you keep yourself oriented, and it's all about aviation. It's all about the vision.
Yeah.
So I said, well, if I'm going to focus on one specialty, I might as well be something that's very applicable to aviation.
Right, and you already had the aviation background.
Mm-hmm. Well, because I was an aviator, basically what I am, and I'm just one that's educated a little farther than that.
Right. So then where did you go? So did the Navy put you through school again?
Oh, yeah.
Okay.
Well, I was in active duty then.
Okay.
It was up in Washington, D.C.
Awesome. Okay.
At the big naval hospital.
And then how did you transition from ophthalmology into becoming an aviation doctor? And how did you make your way to Stallion 51? How did that path?
Well, I mean, after I got done with my residency, I was the chief in ophthalmology at Camp Lejeune, which was pure surgery. Yeah. And then I became the chief of Navy Aerospace Ophthalmology in Pensacola, which is related to aviation.
Right.
And so that's where I learned a lot more about aviation medicine. In fact, I used to teach the residents in aviation medicine. Okay. And then when I got ready to retire from the Navy about 10 years after that, they put me in charge of stuff, because when you get the rank here, you got to be in charge. Right. Okay, so they did that for a while, and then it was time to retire, and I said, what should I do now? And I wanted to do something because I can't sit around, so I knew the guys from Stallion 51. I'd flown their P-51 a few times, and we made a big project, and we're building a new hangar, and we put a medical clinic in it.
Fabulous.
And so I came down there and did that, and I was doing a lot more ophthalmology in those days, but I've kind of gotten away from that because the aviation part has kept me so busy.
Right.
With the special cases.
I was going to say, when you started with Stallion 51, was part of the project and the goal to handle the most difficult cases?
No, the project was to fly exotic warbirds.
Okay.
Which started that way, but then as the business evolved and I got more busy, it became basically an aviation medicine clinic where we do difficult cases.
I got you.
And that's evolved.
Phenomenal.
It's okay. I fly my own bug smasher around in circles now and then.
That's awesome. So you still have, I was going to say, you're so busy, but do you still have time to fly and enjoy?
Well, it's kind of convenient because I can I could get off my desk and in 30 seconds I'm in my airplane. So it's kind of convenient, yes.
That's awesome. Now tell us a little bit, I know that you wanted to talk a little bit about those that may be preparing for the FAA medical. Not only our students that we have here, because of course one of the focuses here at Sun and Fun is education. So can you speak not only preparing for the FAA medical for the students, but then maybe to some of our more, I'm going to use the word seasoned individuals?
That's sort of two categories. For the young people, the young students, you have to assume that they're in good shape and don't have any chronic illnesses.
Okay.
And basically, what they can do to help themselves is to not get in trouble. Not get in trouble, especially with alcohol and drugs. Also, it's not in their best advantage to get diagnosed with mental health issues.
Okay.
Like ADHD.
Right.
Anxiety, depression. And those are tough things to deal with when you're in your formative years, especially the teenage years, with the anxieties and the depressions. We see that.
We're seeing more of it in schools.
And the problem you have these days is the medical establishment is much more willing to make those diagnoses.
Right.
And the people that are making those diagnoses are not necessarily mental health experts. They're family practice guys.
Right.
Which is okay, but then they want to come and get a medical, and they show up with a history of this, and now the FAA doesn't think kindly of that.
Right. And I know, and now let me ask you, is it, I know for the military, like with ADD, the attention deficit disorder, ADHD, attention deficit hyperactivity disorder, military, to pass those physicals, you cannot be on any type of medication. You have to, they do not want to see that. Is it the same with the FAA, for instance, some of the drugs that they currently use for those? Is that something that they don't want to see? Does that preclude you from passing an FAA medical?
It's similar to the military, but it's not absolute.
Okay.
There's always the waiver process, and the FAA calls that special issuance.
Okay.
But for lay people, waiver means an exception to policy. So if a young person has been on ADHD medicine from 3rd grade to 8th grade, and now they're not on it, but they've got that history, so we have to work through a protocol that allows them to be waivered or given a special issuance.
Gotcha.
And it almost always works out.
Okay.
Okay. And it almost always works out.
Okay.
Especially for simple things.
All right.
And
so for the young people.
so the young people, their option is to not get in that situation, but also the alcohol and drugs thing. The FAA is big on alcohol-related incidences, and the number one of those is a DUI.
Thank you.
And the number 2 is underage drinking.
Yep.
So if those are on your record, you're still going to get a medical, but it's going to be much more difficult and time-consuming.
Okay. Now, what about for individuals that might be a little more seasoned? Because a lot of times as we get older.
There's seasoning, and then there's the hot sauce crowd. Okay. So it depends on what decade you're talking about.
I don't know.
But the point is, maintain a healthy lifestyle. And I don't want to go into what kind of vitamins
Right.
to take or how to fry your bacon, but
Right.
the point is, maintain a healthy lifestyle, minimize the bad stuff, maximize the good stuff, the exercise. See your family practice, general practice person, primary care, so they can do all the routine things, the blood tests, the colonoscopies and all that.
Okay.
Keep yourself healthy and do the best you can.
Okay.
And when something pops up, tell your AME about it, talk to your AME about it, go visit your AME, and
That's
work with him.
probably the key.
And work with the
Right.
AME, because the AME is supposed to help you do that.
Right.
To get your waiver, again, that's called a special issuance.
Right.
And the number one reason, a couple of the top reasons that the pilot doesn't do well with these waivers, I'm using that as a lay term now, it's special issuance,
Right.
is because the pilot is nervous, scared, apprehensive, and doesn't want to go through with it. Or they give up.
Okay.
In other words, 90+% of the applications for a special issuance are given. And
That's
of the
good to know.
ones that don't get special issuance, 90% of the time is because they give up.
They just quit.
They just
Okay.
quit because it is irritating.
Right.
It might take you a year.
Okay.
It might take you a couple of years if you're a drug addict. So the point is, and you might not even get one. The point
Right.
is, it depends. High blood pressure that's controlled, easy.
Okay.
Diabetes on oral medicine, not bad.
Okay.
DUI, hard.
Gotcha.
You follow me? It all depends on what level you're at.
Gotcha.
And the mental health and drugs and alcohol is the hardest category.
In either one. Whether
it's the hardest of all of it.
No,
a heart transplant is hard.
Right.
Is in the physical things. That's harder than having one DOI 5 years ago, of course.
Right.
But it's all a combination of things,
Right.
and each case is different.
I got you. That's awesome. Now, let me ask you, what is your advice for maintaining those medical certificates? Is it exactly what you said, making sure that I think a lot of times patients may not communicate with you if they have changes in their physical or in their mental, they don't communicate. How do you maintain that? What is your advice?
The pilots
again,
are supposed to self-police themselves.
Right.
Self-report.
Yeah.
If they've got a medical problem that came up, they should notify their AME.
Do they?
No.
Okay.
They do sometimes.
What,
It depends.
based on your experience, why? What is?
Before we go too far, there's no absolute in any of this stuff.
I got you.
That's why it's called the practice. Okay? There's no
So we
absolute.
practice medicine?
The pilot's supposed to self-police themselves. If they have an issue or they get a new medicine, they're supposed to call the AME office and report it.
Okay.
Do they do it? Well, I mean, a lot of guys do it if it's serious, but sometimes they don't tell me they had their cataract surgeries done until I see them the next time. It might be a year later.
Okay.
Well, does that irritate me? No.
Okay.
Does it irritate the FAA? A little bit.
A little bit. Okay.
Does it irritate the pilot? No, because I give him a medical anyway.
Right.
So, but the point is, he's supposed to tell them.
Okay.
And that's an easy thing. If a pilot had a heart surgery, he definitely should tell the AME.
Right.
And he probably should self-ground himself until he's been upped by the FAA.
Right.
That's serious.
Right.
If he got a new kind of toe fungus medicine, probably don't need to report that.
Right. I got you.
So it all depends.
So it just depends on them. Now, do the AMEs? I know that you were talking about, because obviously when you're dealing with the FAA, a lot of paperwork, a lot of things that have to be filed. Is that something for our students that are getting ready, that are just learning to fly, they're going through this for the first time? Is that something that you help? Do the AMEs help with that? Do they help the students with that? Do they help those that are the special cases?
Okay, the basic Med Express. Now, when a pilot, a student, or anybody wants to get a medical certificate, and the certificates are Class 1, 2, and 3.
Okay.
Quickly, Class 1 being airline captains,
Okay.
Class 2 being all other commercial operations, and Class 3 is non-commercial operations.
General aviation.
Has nothing to do with the airplane.
Okay.
You can fly any airplane in any class.
Gotcha.
Has to do whether you're compensated for and what you're in charge of. Class 1 is airline captains, okay?
Gotcha.
The pilot will go to the Med Express with an X.FAA.gov website and make an account like you do 100 times a year for these
Right.
other stuff. And then you fill out the application, which is the medical application, which is an FAA Form 8500-8.
Okay.
You don't have to remember that. Fill it out truthfully, submit it. You'll get a confirmation number. You make a copy of it. You make your appointment with the AME, the flight surgeon, and you come in, and that's it.
That's it. Awesome. Well, Dr. Busch, it's always a pleasure. Number one, you are a joy. You think fast, you talk fast. I love it when you're on the show. So thank you for sharing your expertise
I
with us.
saw that in a movie once.
You did? No. I also want to go ahead, because of your expertise, I want to go ahead and let our viewers know that those that are watching, there will be a code at the end of the show, and that they will get wings credit for this. So those of you that are watching, please wait until, I believe it is after the credits roll. You will actually get a code. There is a code word, and that you will get wings credit for this. Dr. Busch, as always, I would like to keep you longer, but I know we've got to get you back out get you back out on the field. Are you planning to see the night air show tonight?
Absolutely.
Okay. Did you see it on Wednesday, or were you here on Wednesday?
No, on Wednesday I couldn't make it.
Couldn't make it.
I had to man the clinic all week. I've only been here yesterday and today.
So they made you work while they were here. Wait a minute.
They're working me like they work me like a rented mule.
I'll be sure to do this shout out. Well, hopefully we will see you tonight at the air show. But ladies and gentlemen, again, it is a pleasure. Dr. Busch, always. You are a joy.
Enjoyed it.
Thank you so much. My name is Lori Bradner. I'm with the Florida Aviation Network. We are here at Sun and Fun 51, where we are turning up the fun, which I just did with our awesome guest, Dr. Busch. Love talking to him again. Thank you, Dr. Busch. Once again, join us here for the Sun and Fun 51.